In 2018, $95 million in federal money was spent to fight the opioid epidemic just in Wisconsin. That's according to data compiled by the Bipartisan Policy Center.
And as we reported earlier, Crosse County had 8 drug overdoses in just the past week that resulted in 2 deaths. News 8's Jordan Fremstead tells us how our community is dealing with the problem.
That's right, guys. This is a billion-dollar issue facing communities across the country. Now, one doctor I spoke to at Gunderson Health System says 2019 was a better year for overdose deaths in La Crosse County. However, a permanent solution remains a goal.
It's a very difficult problem to fix.
The opioid epidemic continues to strain communities around the U.S.
This is a unfortunate recurrent tragedy that we've been seeing throughout the last several years with this opiate epidemic.
Dr. Chris Eberlein is an emergency medicine physician at Gunderson Health System. He says La Crosse County is not immune to this problem.
You don't have to go very far outside of your own small box to start to realize how many people this is affecting.
He says there were roughly 22 overdose deaths last year, with data still pending.
That's 2 better than the prior year.
Despite the slight improvement, the county is far from stopping the problem.
In the toxicology reports is that there's much less prescription opioids that are present, which is good. But fentanyl and heroin, obviously the illicit drugs, remain high.
Eberlein says fentanyl is 1,000 times more potent than heroin.
And the users continue to use the same quantity, not knowing how potent it is.
The drug is shipped to Chicago and Minneapolis.
And we're just the route between.
Much like a river, it flows into the La Crosse community.
A few weeks ago, Minneapolis had a large outbreak of overdoses. And then about a week or so later, we get it.
He says the drug is more profitable for the dealer and in some ways more cost-effective for the user. At the same time, fentanyl is more detrimental to the community it infests.
It took us a long time to get here. It's going to take us a long time to get out.
The community foots the bill for programs to get these people off these drugs. However, if the community doesn't continue to work the problem, emergency police and healthcare costs will continue to rise.
We can prevent it from happening in the first place. All those downstream costs go away.
Eberlein says people can't give up.
Do we have a perfect treatment for it yet? No, but we're using the best tools that we have to treat this disease.
Now, health experts say when an overdose patient comes to the hospital, oftentimes they can't cover their own healthcare cost, so the healthcare facility ends up absorbing that cost, which affects those of us who have health insurance. So Eberlein says we should all care about fixing this problem.
Okay, thanks a lot, Jordan. And officials with the La Crosse County Medical Examiner's Office expect to have official 2019 overdose numbers in the next couple of weeks.